The world, by that I mean the US, was starting to hear about the work of Dr. Ponseti. And it was a particular paper that Fred Dietz wrote with a 30-year follow-up of Ponseti's results. And Shafiq Pirani, a surgeon of Ugandan origin working in Canada, came over to Uganda and taught the Ponseti method. And then very kindly he came down to Malawi with a couple of colleagues of his, Norgrove Penny and Mikhail Steenbeck, a physiotherapist, and told us all that they've been doing in Uganda with Clubfoot. I have to say, at the beginning, I was a bit skeptical, thinking, do you know, guys, I know how to treat club feet. I've been doing these operations for years, and I do them pretty well, thank you very much. Right. And I get these feet straight. I don't think there's a particular need for a new method. However, I read the papers they brought down, and I played with the models, and I thought, actually, this could work. And so what we decided to do in Malawi is we decided to try this method, the Ponseti method, with the newborn kids in 2 of the towns, in Blantyre, the town where I lived, and in Lilongwe, which was the other big town in the country. The country's only got really 2 big towns. So we tried it in the 2 big towns, or cities. We decided to try it for a year, and at the end of the year we reviewed our results, and the small number of physiotherapists who've been doing the treatment were amazed. They said, this is working. We've got kids we've been doing 20 or 30 gentle manipulations on using the old technique, the so-called kite technique, and we're getting nowhere. We're now finding these feet are melting into the right positions. It's wonderful. Physiotherapists were really pleased, and we also found that the number of cases that we needed to operate on had gone down. So we had a very good positive result from the Ponseti technique, and we decided to spread the technique throughout the whole country. What then followed with Shafiq Pirani's advice was a military operation. Malawi is quite small, 12, 13 million people in the country, and has 25 health districts. So we decided to set up a Clubfoot clinic in each of the health districts. So 25 Clubfoot clinics. We decided that needed to be 3 or 4 people in each of the clinics who could do the Clubfoot treatment. So we needed to train about 100 people. So we set up regional training programs in the north, the middle, and the south of the country. And we systematically set about training 100 people in the Clubfoot method. And for that, we used the Clubfoot models. And I have to say, those Clubfoot models were just brilliant. You get your hands on them, and you instantly know what's going on inside the Clubfoot. And the people who we trained really responded well to those models. The beauty of those models is that, yes, you can just see how the bones move. You can see exactly where to put your fingers.